Hello my geniuses, welcome to another anatomy lecture series today. It's your great science tutor Lorenzo, and we'll be talking about the muscles of the forearm. The muscles of the forearm, but under the muscles of the forearm today we'll be starting with the muscles of the anterior compartment of the forearm, because in the forearm you have the anterior and you have the posterior compartment. So if you are just joining me in my video, make sure to subscribe and turn on your post notification button so that anytime I drop any video you'll be sure to be notified. If you are just joining me for the first time, and you want me to make any topic for you, drop it down in the comment section. I promise when I see it I'll make that video solely for you. So let us jump right into the video. So in the muscles of the anterior compartment of the forearm, what is the easiest way to understand them? One, when you look at supinate your hand, like open your hand now. When you supinate your hand, the muscles in the anterior compartment, the muscle in the front of your forearm, because we have the arm. After your shoulder you have your arm, after your arm you have your forearm, after your forearm you have your hand. So in between your arm and your hand marks your forearm. You get it now? So that's what we want to talk today. And in the forearm you have the first compartment, which is the anterior, and you want the one in the back called the posterior compartment. So in the anterior compartment, one thing you have to know about it contains 8 muscles. It contains what? 8 muscles. 5 is superficial, 3 that is deep. So it's divided into superficial and deep. 5 is superficial, 3 is deep. Are you getting me now? And it contains 2 arteries, which is the radial and ulnar artery. So the radial and ulnar artery supplies this muscle too. And also the nerves are what? You have 3 nerves. What are the 3 nerves? You have the median nerve, you have the ulnar nerve, you have the radial nerve. Very, very important. Again, you have 8 muscles, 5 superficial, 3 deep. But some literature will say you have 3 deep, you have 3 compartments. You have the superficial, you have the middle, you have the deep. You get that? But usually we can just put it into superficial and deep. So 5 superficial, 3 deep, and you have 2 arteries, which is the radial and ulnar artery, which is a continuation of the brachial artery. Then you have 3 nerves. So you have the median nerve, you have the ulnar nerve, and you have the radial nerve. You get it now? So simple. So this is the muscles of the anterior compartment of the forearm. 8 in number, don't forget. 5 superficial, 3 deep. We'll be talking about the superficial and deep using mnemonics, so you will not forget it. Okay, now, so one thing you have to know about all of them, very, very important. Most of the time they are coming from the common flexor origin, which means they have one origin, which is the medial epicondi. We call it the common flexor origin. They are coming from the medial epicondi. Now don't forget, so the medial epicondi is in the humerus, the lower end of the humerus. So if we are starting now, remember we have 5 superficial, which we'll be starting from now. In the 5 superficial you have what we call PFPFF. PFPFF, don't forget, PFPFF, PFPFF. Now in the P you have what we call the Pronator Teres. We have the Pronator Teres, PFPFF, Pronator Teres. The F, Flexor Carpi Radialis, Flexor Carpi Radialis. PF, P is what? Palmaris Longus, Palmaris Longus. Don't forget, PFPF. Another F again, Flexor Carpi Ulnaris, Flexor Carpi Ulnaris. Then the last one is Flexor Digitorum Superficialis, Flexor Digitorum Superficialis. So that is PFPFF. Don't forget, that is the mnemonics for the superficial compartment of the arm. So under the anterior compartment is divided into superficial and deep. PFPFF. Now under the P, which is the Pronator Teres. So where is the Pronator Teres originating from? So important and so simple. It has 2 heads. Are you getting me now? It has 2 heads. So you have the superficial head and the deep head. So the superficial head, we call it the humeral head. The humeral head is originating from the medial epicondi, the common extension origin, flexor origin. Don't forget, superficial head is coming from medial epicondi, while the deep head is, we call it the ulnar head, is coming from the coronoid process. So it has a superficial head, which is the humeral head, coming from the medial epicondi, because I told you that all of them is coming from the medial epicondi. Then we have the deep ulnar head coming from the coronoid process. Again, so where is it inserting? If it's coming from this area, which is the medial side of the forearm, Where is it going to? It is going to what? And inserting in the lateral surface of the radius. So it's inserting on the radius. So you see the picture, I'm giving you the picture, coming from the what? As from the superficial head, which is the medial epicondyle. So it passes through the ulnar, also originating from the coronoid process, and is inserting on the lateral surface of the radius. You get it now? So Pronator Teres, coming from the humerus and the ulnar, inserting on the radius. So simple. Coming from the humerus and the ulnar, inserting on the radius. So simple. So the chief work is very simple. What does it do? Pronation. But it is not a chief pronator, it's an assistant pronator. So we call it Pronator Teres 2 head. It's just an assistant pronator, not a chief pronator. Are you getting me? So it also helps to flex the elbow. Are you getting me now? Apart from being an assistant pronator, it also helps to flex the elbow. So simple. So what nerve? I told you they are all supplied by median nerve, but the superficial branch of the median nerve. So very simple. So if you want to test a patient with Pronator Teres, you have to make sure the patient is supinating and want to try to pronate against resistance. If the patient is pronating their hand, putting their hand under, like turning their hand, as if you, instead of opening your hand up, you are turning your hand down. So do it against resistance. Let the patient prevent you from supinating their hand back. So that is how to test for pronation. You get it now? So the next one is Flexor Carpi Radialis. So we have said that the Pronator Teres is coming from the humerus, the ulnar, and inserting on the radius, while the Flexor Carpi ulnar is chiefly coming from the what? Medial epicondyle. Common flexor origin, medial epicondyle. You get it now? So when it comes from the medial epicondyle, it is inserting in the what? Base of the second and third metacarpal. Don't forget PFF, base of the second and third what? Metacarpal. Very easy. Coming from the medial epicondyle, normal flexor origin, inserting on the base of the second and third metacarpal. You are seeing it on your screen. Second and third metacarpal. Now, since you have known this one, nerve is the same thing, median nerve. Nerve is the same thing, what? Median nerve. And what is it? It is the chief flexor of the wrist. So it flexes the wrist only. Why? Because it is passing the wrist. So any muscle that passes a joint will do what? Any muscle that passes a joint will give a control to that joint. So it gives a control to the joint, and what is the control is giving to the joint? It is flexing the wrist. So if it's flexing the wrist, okay, now after flexing the wrist, which is his chief work, that's what it do. It flexes the wrist. Do you get it now? So the next one we are talking about, don't forget, originating from the medial epicondyle, inserting on the base of the second and third metacarpal. Very easy. The next one is the Palmaris Longus. So what is the Palmaris Longus? Very simple. It's also coming from the same place, medial epicondyle, because I said everybody comes from the medial epicondyle. So when it begins from the medial epicondyle, where does it insert? It inserts on the flexor retinaculum. So I'm showing you the flexor retinaculum. So the flexor retinaculum is just a deep fascia band. It's a deep fascia band from the deep fascia. Now we have skin, we have superficial fascia, we have deep fascia. So it's a deep fascia band that covers the carpal bone. So it begins from the scaphoid and the trapezium, and it is attaching the pisiform and the hamate. So just covering it from end to end. So it converts the palmar arc into what? A carpal tunnel. Before it is just a palmar arc, just an arc without the flexor retinaculum. So when you add the flexor retinaculum, you'll be getting a carpal tunnel. And the carpal tunnel, I discussed it in my video, so check the video on carpal tunnel. So I discussed it there, where I talked about the carpal tunnel and what passes through the carpal tunnel. 10 structures passes through the carpal tunnel. So it was a palmar arc before, converted by a flexor retinaculum. That is where the Palmaris Longus is inserting. Very simple. Palmaris Longus is coming from what? The common flexor origin, which is the medial epicondyle, and inserting on the what? Palmaris and inserting on the what? Flexor retinaculum, which is a deep facial band. Very simple. So now, what is the nerve supply? The nerve supply is just the median nerve. Very simple. And this one is not a chief flexor, it's a weak flexor, because it's ending on the what? Flexor retinaculum. So it's just a weak flexor. And also it is also affected when the palmar aponeurosis is tensed. So when you tense the palmar aponeurosis, it's also tense at that particular point. Are you getting me now? So it is not present in everybody. Do you get it now? It's not present in everybody. Yeah, it is just approximating 10 people. So So it is absent in like 10 people. It's not present in everybody. It's absent in like 10 people. And sometimes surgeon grafts it away when they want to do a tendon transfer. They want to put a tendon to another place, and they just take it because it's absent in some people. And sometimes there are so many muscles that are already flexing, so you don't need your palmaris longus like that, and it's not in everybody. So since they just do a tendon transfer and carry it away. So we are done now. The next one is the Flexor Carpi Ulnaris. So we have done the Pronator Teres toe head inserting on the lateral surface of the radius. We have done the Flexor Carpi Radialis coming from the common flexor origin, which is the medial epicondyl, inserting the base of the second and third metacarpal. We have done the Palmaris Longus. The Palmaris Longus is originating from the common flexor origin, which is the medial epicondyle, don't forget, and inserting on the flexor retinaculum. It's a weak flexor, while Flexor Carpi Radialis is a chief flexor of the wrist. Are you getting that? Chief flexor of the wrist. While Pronator Teres is an assistant pronator. You guys, it just assists in pronator. It's not a chief pronator. So the Flexor Carpi Ulnaris too is the same thing too. Where is it originating from? This one originates from two head now. So you have, just like the Pronator Teres, it has two head. So the first head is the humeral head, normally medial epicondyle, common flexor origin, normal head. Flexor Carpi Ulnaris two head. The humeral head coming from the medial epicondyle, and the ulnar head which is coming from the olecranon process. So which means it's coming from the medial epicondyle and the olecranon process. You get it now? So simple, so important. So you have to know. But sometimes it can come from the medial epicondyle, which is the first one. It can also come from the coronoid process. So it can take some branches from the coronoid process and also the olecranon process. So same thing. But when we go to the Pronator Teres, it's coming from the medial epicondyle and also the coronoid process. But this one is coming from the medial epicondyle and the olecranon process. Don't forget. Are you getting now? Don't forget. So where is it inserting to? Where is the Ulnaris inserting to? So it's inserting to the two carpal bones that are in the medial side, which is the hook of hamate and the pisiform. The hook of hamate and the pisiform. So easy, so sweet, so simple. Are you getting it now? So it's inserting on the hook of hamate and the pisiform. So simple. So since you have said it now, what is its work? What is the Flexor Carpi Ulnaris? The same thing. It flexes the wrist. So it is flexing the wrist at one particular point by assisting, by working with the Flexor Carpi Radialis to flex the wrist, and also it participating in adduction. Are you getting now? Participate in adduction of the what? Wrist too. So very simple. Flexion of the wrist chief working, and it assists with the Extensor Carpi Ulnaris too for adduction of the wrist. So easy. So very so easy. Now the last one under this category of superficial muscles is the what? Flexor Digitorum superficialis. Now in the Flexor Digitorum superficialis, like I said, some people say it's in the middle compartment of the hand. So I'll just say that we have a superficial and a deep. Are you getting me now? So it is always in the middle compartment. That's what they say. But which is some book. So it is the largest superficial muscles. It's a very large. Okay, it's the largest superficial muscles. And what does it do now? Where is it originating from? Very simple. It comes with from the same place, humeral head, which is the medial epicondyle. Very easy. Humeral head, medial epicondyle. It also comes from the ulnar. Are you getting now? Yeah, just a humeral ulnar origin. Medial epicondyle, first one. Coronoid process, second one. Humeral ulnar origin. And also it comes from the radial head. This is the anterior oblique line of the radius. Are you getting now? The anterior oblique line of the radius. But sometimes some people just say it is originating from the what? Radii tuberosity. Okay, now from the radii tuberosity. But don't forget the anterior oblique line, which is the radial head, and also the medial epicondyle and the coronoid process, which is the what? Ulnar head. So you see it in your screen. All I want you to do is just to see it in your screen, see the pictures, and get used to it. You get that? PFPFF. Don't forget PFPFF. So far, who has two head that we have gotten? The Pronator Teres has coming from two head. The Flexor Carpi Ulnaris is coming from two head. Why the Flexor Digitorum superficialis come from two head? Why the Palmaris Longus and the Flexor Carpi Radialis are only coming from one head, which is the humeral head? So easy, so sweet. Yeah, I hope you are getting it. So where is it inserting? Very simple. It crosses the wrist. I get it now. And when it crosses the wrist, it is inserting on the medial phalange, which is the middle phalange of the fingers. Middle phalange of the fingers, you are seeing it on your screen, the middle phalange in the middle. So in our fingers we have three places. You have the proximal phalanx, you have the middle phalanx, you have the distal phalanx. The proximal phalanx, that's why you see they are divided by crease. What is crease? Crease is that black stuff in your hand. You get it now? That black stuff, that black lines in your hand. So we call it crease. So if the crease divides the finger into what? Proximal, middle, and distal phalanx. But this flexor digitorum superficialis insert on the middle phalanx. Therefore, remember the law: when you cross a joint, you have to give a function to that joint. So one, it crosses the wrist. So what will it do to the wrist? It flexes the wrist. So simple. Flexion of the wrist. And if you flex the wrist, also it passes the MCP joint. So where is the MCP joint? The place where the metacarpal continue as a phalanx. So the first crease you see, you have the MCP. I'll be showing it on your screen now. So it also flexes the MCP joint. So it flexes the MCP and the proximal IP. So flexing of the wrist, flexing of the MCP, which is the metacarpal phalangia, and flexing of the what? Proximal interphalangeal, PIP. So flexing the MCP, flexing the wrist, and flexing the PIP. Don't forget, it's just when any muscle cross a joint, they will give a function and they will move that joint. So that's the law. If you cross a joint, you give a function to that joint. So the nerve is still median nerve, not changing. So we are done with the superficial muscles now. So we'll be going over to the deep muscles. So the next one we'll be talking about is deep muscles. Very simple, very nice. So these deep muscles is a little bit different, but it has its own mnemonic. The mnemonics for this one is FFP. Simple. FFP. You get it now? FFP. So simple. Or you can do it PFF. PFF or FFP. The first one is PFPFF. Are you getting now? So this one is also now PFF. So when you remember PFF, you remember the deep muscles. You get it now? PFF. But that one is PFPFF. You get it now? So simple. This one is PFF. So when we are using PFF here, what is P? Which is one of the deep muscles, which is the what? Pronator Quadratus. Don't forget. Pronator Quadratus. Now the Pronator Quadratus is just a higher form and a deep muscles of the Pronator Teres, so which gives more functions and much more importance, which is the deep and the what? Chief muscle of Pronator. So where is it originating from? So simple. Now it's coming from the what? Anterior surface of the ulnar. Are you getting now? The anterior surface of the ulnar. Simple. So there are so many things you can know about it. Coming from the anterior surface of the ulnar, the 1/4 of the anterior surface of the ulnar shaft. That's where it's coming from. But just know anterior surface of the ulnar, so you not go deep and get yourself confused. But it's just for the context, maybe for an exam, you know that is the lower 1/4 of the anterior surface of the ulnar shaft. And where is it not inserting? It's inserting on the shaft of the radius. So coming from ulnar, lower 1/4 of the ulnar shaft, inserting on the radius, lower 1/4 of the anterior surface of the radius. So anterior surface of the ulnar, anterior surface of the radius. Just know it like that. Pronator Quadratus, anterior surface of the ulnar, anterior surface of the radius. Very simple. Very simple. But if you want to know for your textbook concept, it's coming from the lower 1/4 of the ulnar shaft, inserting on the lower 1/4 of the radial shaft. Very simple. So what is it doing? It's the chief muscle of pronation. It's the chief muscle of pronation. Why, like I said, the Pronator Teres is just an assistant on pronation. Very simple. Again, so the nerve here, remember I said the 5 superficial muscles are the superficial branch of median nerve. You get now, the superficial branch of median nerve. But these muscles here are the deep branch of the median nerve, which is the what? Anterior interosseous nerve. The anterior interosseous nerve is the deep branch of the median nerve, which is supplying the Pronator Quadratus. So PFF. Now what is the first F now we're talking about? The first F we're talking about is the Flexor Pollicis Longus. The Flexor Pollicis Longus. Now the Flexor Pollicis Longus, with the name Flexor, Pollicis means thumb, Flexor means to flex the wrist, Pollicis means thumb. You get it now? Then longus means it is long, which means the thumb, it flexes the thumb and the muscle is long. It flexes the thumb and the muscle is long. So simple. You get it now? So that's how you know some anatomical terms that we use. So now, where is it originating from? Are you getting now? Where is it originating from? It's originating from the anterior surface of the radius. and the interosseous membrane. Anterior surface of the radius and interosseous membrane. That is the same thing. Anterior surface of the radius and interosseous membrane. So, but for textbook concept, you say it has upper to third of the anterior surface of the radius. But just know anterior surface of the radius and what interosseous membrane. Since it's working on the thumb, so where will it be inserting? It's inserting in the anterior surface of the base of the distal phalanx of the thumb. So it will go up to, remember, the other fingers have 3 parts, which is the proximal, middle, and distal phalanx. But the thumb has only 1. It has 2. So it has proximal and distal phalanx because it's divided by 1 crease, which is 1 crease is dividing it. So 1 crease is dividing the thumb into proximal and distal phalanx. So since 1 crease is dividing the thumb, it is inserting on the anterior surface of the distal phalanx. That's what it's doing. You get it now. So others have 2 crease dividing them, which is the proximal, middle, and distal phalanx. And we say the flexor digitorum superficialis inserted on the middle phalanx. You get it now. So since it's inserted on the anterior surface of the base of the distal phalanx, so what is it doing to it? What is it passing to? It's passing to the wrist, flexing the wrist. It's passing to the MCP. What is it doing to the MCP? It's flexing the MCP. And what is it doing to the IP? Distal IP, it is also flexing. So it is flexing the thumb at the wrist, at the MCP, and at the interphalangeal. So simple. I hope you are enjoying it. It's so simple. So the last one is the big gun of these deep muscles, which is the Flexor Digitorum Profundus. It is the strongest muscle and the biggest muscle in the deep compartment, even the most bulkiest muscle in the anterior compartments of the forearm. So after the Flexor Digitorum Profundus, you see the Flexor Digitorum Superficialis. Hope you understand me. So remember, PFPFF, you have Pronator Quadratus, you have the Flexor Pollicis Longus, and you have the Flexor Digitorum Profundus. These are the 3 muscles in the deep compartment of the forearm. You get it now. So the last one we'll be talking about is the Flexor Digitorum Profundus. The Flexor Digitorum Profundus. So when you remember the Flexor Digitorum Profundus, you say the most bulkiest and biggest muscle in the forearm. You get it now. So after it is the Flexor Digitorum Superficialis. So since you have understood this context now, where is it originating from? So it is a very big muscle, so it has 3 origination. It has 3 origination, but it's so simple. I will break it down into 2 origination really. Sometimes for your textbook context, we have to make it 3 in case you go and see an exam anywhere like that. Since Flexor Pollicis Longus is originating from the anterior surface of the ulnar and its interosseous membrane, this also, the Flexor Digitorum Profundus, is originating from where? The anterior surface of the ulnar, because the Pollicis Longus is originating from the anterior surface of the radius and its interosseous membrane, while the Flexor Digitorum Profundus is originating from the anterior surface of the ulnar and its interosseous membrane. Flexor Digitorum Profundus, anterior surface of the ulnar and its interosseous membrane. Flexor Pollicis Longus, anterior surface of the radius and its interosseous membrane. You get it now. You get it now. But also, Flexor Digitorum Profundus can also come from where? It can also come from some parts, which include the posterior border of the ulnar along the flexor and the extensor carpi ulnaris muscle. This is just like a sub addition of its origin, but the main thing is anterior surface of the ulnar and the what? Anterior surface of the ulnar and its interosseous membrane. But it can also come from the what? Posterior border along the flexor and the extensor carpi ulnaris. Also, it can also come from the medial side of the olecranon and coronoid process. But these are sub-origination. These are sub-origination. You can see it on your screen. Follow it up. It's very, very simple. See, I sweet in my mouth. Just follow it like that. You get it now. So, where is it inserting to? It's just inserting on the what? Distal phalanx of the what? Fingers. The distal phalanx of the fingers. While its brother, which is the Flexor Digitorum Superficialis, is inserting on the middle phalanx. So it is inserting on the distal phalanx of the what? Fingers. very very simple. But the only difference now, it has two innervations. So it's one of the muscles that has two innervations. So it has the ulnar side, because it's inserting on the distal phalanx of the four fingers, not with the thumb is not among, it's just the four fingers, which is second to the fifth finger. So it's inserting on the distal phalanx of the four fingers. Same thing with the Flexor Digitorum Superficialis, inserting on the four fingers, which is from the second to the fifth. So but the Superficialis is innervated by medial nerve, why Profundus is innervated. It has dual innervation, which is the medial side, which is the fourth and the fifth finger. I get him now, is supplied by the ulnar nerve, but it is just like 1.5. So the fifth finger and the middle of the fourth finger, is supplied by ulnar nerve. The middle finger, which is the fourth and the fifth finger, but inside the fourth is divided into two. There is not, the ulnar nerve do not supply all the four fingers, it supply half of the fourth finger, while the fifth finger supplies it, while the medial nerve supplies the second, third and the half of the fourth. Second, third, half of the fourth medial nerve, half of the fourth and the fifth ulnar nerve. Don't forget it. So it's a very very important muscle. It's powerful and bulky. It has dual innervation, medial and ulnar nerve. It is the grip muscle. So in the action, since it is coming from where, it is coming from the wrist. Are you getting now? It passes the wrist, rather flexes the wrist. It passes the MCP, flexes the MCP. It passes the proximal IP, flexes the proximal IP, and it also flexes the distal IP. So it is what we call the chief grip muscles. It's the chief grip muscles, while the Flexor Digitorum Superficialis is the assistant grip muscles. You get that? Assistant grip muscles, and they all pass through where we call the carpal tunnel. They pass through the carpal tunnel. So the four tendons of the Flexor Digitorum Profundus with the four tendons of the Flexor Digitorum Superficialis, together with the Flexor Palmaris Longus and the medial nerve, they all passes through the carpal tunnel. You get it now? So that is very very important. It's very very important. And the one thing about the chief, all the things I've said, note about the Flexor Digitorum Profundus is, do you know what it also does? It also marks an origin from the lumbricals. So all the lumbricals also is originated from the Flexor Digitorum Profundus, the lumbrical muscles. So there are four muscles that is originated from the Flexor Digitorum Profundus. Very very simple. Hope you are getting it. We have ended this segment on the muscles of the anterior compartment of the forearm. I told you they are 8 in number, 5 superficial, 3 deep. They are all innervated. The anterior compartment is innervated by medial and ulnar nerve, but the forearm is innervated by medial, ulnar and radial nerve. But this anterior compartment we have just talked about is medial and what? Ulnar nerve. So they have also blood supply. You have the radial artery and the ulnar artery. Very very simple. So I hope it all made sense to you and you have understood everything I've talked about with my mnemonics too, and with my easy ways of explaining. You get it now? So hope it all made sense to you. So if you are just joining me for the first time, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. But if you want me to make a video for you, drop it down in the comment section. I promise I'll make that video for you. So the next we're going to is muscles of the posterior compartment of the forearm. See you later. Bye.